It's always been a challenge for academic researchers because making a difference to clinical practice takes a long time, and they could, as a research team, focus on achieving the academic research outputs, but they like addressing problems. They inspire others to want to sort out problems that patients or the public or health and social care staff have identified. So that's what drives them.
The needs of our children and families are our priority, and actually that was the exact same for NMAHP as well. So the partnership, it was very much that we were all equal and we all brought something to the project.
They have physio, speech and language therapy, OT and nursing. It's unusual that you would get a research team that draws on all of those specialist backgrounds, and I think pooling all of that knowledge, that skill, that interest, that's the added value the unit brings.
I've only got to look at their website to see some of the work that they're doing, that their whole ethos is very much sort of real life, pragmatic and effective interventions for patients.
They've got a busy clinical job, but the people who are doing short-term secondments, their PhDs, they're excited, thinking research is a positive thing to do.
So much that midwifery research has done to improve maternity services, and I think it's incredibly important that we give midwives those opportunities to develop that research.
You need people that are really linked in order to design research that's going to be meaningful and add something to the service, but also to implement that in a way that takes into account the context.
We were nervous to start with, but purposefully sought out a unit that had a reputation for identification of products that could be applied into changing practice. And so the work that our research paramedics have done has actually been applied not just in terms of new practices within the Scottish Ambulance Service, but the GR-CALC guidelines, which all of the UK ambulance services use.
It is recognised as a centre of groundbreaking research and, crucially, of involving people affected by stroke in their research programmes, and that's, I think, one of their unique selling points.
If you have a cycle of short-term funding, we're not going to get that longevity, those programmes that can really make a difference to the care that we provide.
It's about, how you translate whatever has been produced as a result of research into action, so that we can eliminate that statistic about it taking 17 years to get research into practice.
They're just a really down-to-earth group of people, and that's what we like.
Supporting the AHPs in the way that they do to conduct research and to look at better outcomes for people is fundamental.
I am not sure where my career would have gone had this fellowship not came up at the right time. Been a real life raft. It's exciting when you do stuff that you feel makes a difference to patients.
This way of working across disciplines, the ethos of seeking to work with people differently, I think it's their niche.
You don't get your trials published in places like The Lancet unless they are really showing impact for healthcare across countries and health services.
That welcoming of individuals, whoever they are, seems to be a particular feature.
It was originally intended that those paramedics would be on secondment for 2 years, and one of them remains with that collaboration.
They're innovative, they're future thinking, and they just need to keep doing that.